Good morning on this Thursday. I'm Jessica Lovell, in for our Chief Medical Officer, Dr. Steve Stites, who is enjoying a little time off this week. Welcome into the morning update on COVID-19 here inside the Dolph C. Simons Jr. Family Broadcast Studio. Well, we know that from the get-go, one of the most vulnerable groups of people at risk for contracting and falling gravely ill from COVID-19 is our seniors, our elderly population, and we have watched outbreaks among residents and staff at nursing homes across the country. In fact, 43% of all deaths, and then 11% in the U.S. and 56% in Kansas, they are linked to older adults living in congregated living spaces. And one of our very own doctors here at the health system was one of just 25 experts selected out of 800 applicants to be appointed to the National Coronavirus Commission for Safety and Quality in Nursing Homes. This group will better help determine the pandemic's immediate and long-term implications on nursing homes, and that expert joining us right here in studio is geriatric medicine specialist, Dr. Jessica Kalender-Rich. So to put it lightly, she knows her stuff. So we're going to talk with her here in just a moment. So thank you for joining us today.
Thank you.
But first, we've got Dr. Dana Hawkinson. He is our Medical Director of Infection Prevention and Control. He is joining us with a little shout out this morning. I'll let you take it away.
Yeah, hi. Yeah, I'd like to say happy birthday and I love you to my mother. She has been a wonderful, loving mother and continues to be a loving grandmother to all of her grandchildren. So happy birthday, and hopefully we'll be around for many, many more.
Happy birthday, Roseanne, right?
Roseanne.
She watches us every day.
Yes.
Watches her boys, so thank you for
So unfortunately for COVID, is one good thing that she can see me every day, but, we would still like COVID to go away.
That's right. Well, let's talk about the numbers
Yeah.
today.
Again, we have been really quite surprised and happy that our numbers haven't continued to go up since reaching that recent peak of 24 patients in the hospital. But right now we only have 17. So it's really been fluctuating the last few days between 15 to 17. 6 of those 17 patients are in the ICU and 2 of those are on the ventilator. Again, we do have young people here in the hospital, in the ICU and in the regular medical surgical floor for COVID-19. So those are anywhere from 25 to 45. So it is affecting young people as well.
Dr. Kalender-Rich, we have, welcome, and we have mandatory masking starting tomorrow. I want to talk, give you the floor and tell us a little bit about what you're seeing in your field and how you think that's going to affect the elderly folks.
I mean, I think mandatory masking is something that has been needed and is needed. We already in the nursing facilities have had mandatory masking for 3 months now. And so the truth is, given the risk of the people out in the community and the need to maintain their safety so that they can come in and help our older adults in the nursing facilities, anything we can do to protect them is the best thing that we can do. And mandatory masking has that opportunity.
Will you tell us a little bit more about this Coronavirus Commission that you are now a part of? How did that come together? How did the need form?
As coronavirus became more widely known and it became really obvious that it had the highest risk of mortality and morbidity for our older adults, particularly those in the nursing home setting, there was a recognition that we really needed to figure out how and why there were outbreaks occurring in that setting and what could be done to fix that and prevent them in the future. And so this was created by the federal government in order to really seek out the answers to some of those questions. And I'm really grateful to Senator Moran and Senator Roberts for supporting my nomination for that committee.
Well, congratulations, right?
Yeah, and I would like to say, even though we're seeing younger people now, absolutely the nursing facilities are still a major risk because who is working in those facilities and everything that those facilities can do to try to mitigate the risk of people coming in or workers coming in who are infected. As the disease continues to spread, we have to expect that more and more people who work in those facilities or have associations with it will be infected as well.
Well, I'm so glad both of you are here because, as promised, we're going to get to a lot of community questions. We know a lot get unanswered throughout the week as so many come in. But first, we want to see if there's any questions from the media this morning. Bob Hallinan, he is our executive producer here at the health system. He's going to be the voice today, but you have a question from the media, right, Bob?
We do. We have one that came in already from Mary Rupert with Wyandotte Daily News, and she wants to know, some mask orders have exempted deaf people, mentally challenged people, and those younger than 5 years old. Would you be able to give us any reasons why these might have been exempted? And even more importantly, what advice do you have for people who are their caregivers?
Yeah. You want to take any of that? Okay. So, certainly when we talk about mask use, we are talking about the majority of the population. There are those small subpopulations, such as Bob mentioned, such as the very young, the deaf, the hard of hearing, the other people with severe medical conditions that can't wear the mask. And when the mask mandates or orders are put into place, those types of things are taken into account for various reasons. One with the deaf, it would be having to deal with, obviously, hearing and speaking or signing. Otherwise, young children, it's very difficult for not even young children, but even older children to continue to have a mask on. Obviously, people with severe medical problems such as COPD or other breathing problems will have a trouble getting oxygen. But for the majority of the people, when we talk about mask use, that is who that is for. There are obviously select subpopulations who are not able to tolerate a mask for one reason or another.
Did you want to add on to that?
I mean, I think the biggest part here is we're looking at really the benefits to the entire community of everybody wearing masks. But that said, we have to look at the risks and benefits for each person. And so there is a small subset of people for whom the risks outweigh the benefits, but it's a very small subset.
That's a good question. I have a question from Becky. She said, my 91-year-old mother lives in her own apartment in an independent living facility. There are no cases at this time. What advice do you have for her? What kind of precautions should they be taking?
So precautions from the standpoint of her mother, right, would start with really practicing hand hygiene, physical distancing, doing all of the things that we're recommending for everyone else. But the truth is, when it comes down to also protecting her mother, she and any of the loved ones that would be seeing her need to also be very diligent about the same things. So because every contact that they have also brings a risk into the mother, right? So when we think about visiting our older adults or our vulnerable population, we have to think about where we have been and ensure that we are doing all of the right things to protect ourselves, not only focused on ourselves, but also on the older adults that we want to spend time with.
Bob?
Yeah, Nick wants to know, how soon will a test show that you have COVID-19? Immediately after your exposure? 2 to 3 days?
We get this question a lot.
That's a very good question. So, again, we go back to one of the more seminal papers and publications looking at people who develop symptoms. So we know that a small population of the people can develop symptoms at about 2 days after infection. We know that by 5 to 7 days, most of the people are going to have symptoms if they have symptoms. That being said, we understand that the most critical time when you are shedding virus is probably 1 to 2 days prior to having any symptoms at all. So you could conceivably have a positive test even 1 day after infection. That'll probably be a small amount of people, but usually by 3, 4, 5 days after you have had possible exposure, that's probably going to start to be in the greatest time when you can detect it on PCR. But certainly we can see that maybe even 1 day after exposure, depending on the level of exposure, how much virus you were exposed to, you could probably have a positive test. But certainly as you move further from that, 2, 3, 4, 5 days from the exposure, the chance of you having a positive if you were infected, now it's a positive PCR test, not an antibody test or an antigen test, is going to be greater than, say, 24 hours after exposure. But certainly even 24 hours after exposure, some people may have a positive test.
Dr. Hawkinson, Susan wants to know, true or false, she hears sunlight kills the virus. Is this true?
Yeah.
Is this false?
So we have dealt with this too. This is a very common question. There was concern and hope that as we move into the summer months, increased sunlight as well as the temperature was going to help decrease the viral spread. Obviously, if we look at the south, where there is really higher temperatures than, say, here or in further northern latitudes, we haven't seen that. We do know that UV rays, and we can get UV rays from the sun. UV rays do kill the virus. Again, this is not going to be a major mode of decreasing the spread currently, but we know that in general, UV rays can kill a lot of different things, bacteria, viruses. This virus is no different, but again, we wouldn't use that in the normal community setting as one reason that would say we would decrease infection. Certainly, in the hospital setting or on some reusable masks, they use UV disinfection, but just in the normal community, that really is not a large factor in decreasing the spread of the disease.
Yeah, don't rely on that.
Correct.
Don't rely on the sun. All right, Bob, next question.
Sarah says she thinks she's been feeling symptoms for quite a while. How do I get testing or support when my primary care doctor won't send me? The doctor seems to think if I'm not in the hospital, I can sit at home taking aspirin. How do I get help?
Yeah, I think now there are walk-in areas to be tested, such as CVS and probably other pharmacies where you can go and get a test. Other labs around the city may be able to do it without a doctor's order. But really, again, continue to have those conversations with your primary physician, with your medical team, and then make that decision from there. But I think there are ways to walk in, and I think other community areas, community organizations and health institutions are having walk-up clinics for testing as well. So that might be available to you also.
Dr. Kalender-Rich, Marley wants to know, and so many people are wanting to get back to church, is it safe for people to get back to church? We know that's a place where our elderly population likes to go as well. What is your recommendation?
I think the safest thing continues to be masking, physical distancing, and really being thoughtful about how we're exposed to the virus. And for that reason, I think each person needs to take into account their own personal health and the health of those that they are in contact with. I would say small groups are always better. I know that my own religious institution actually has begun doing outdoor services. I think there are some ways that we can mitigate the risk, lower the risk, but still participate in these really important activities.
Bob?
Yeah, I think faith is very important. We need our faith right now. I was on a meeting with the Archbishop a couple days ago. We want people to get back to celebrating with other people. We want people to get back to the mosque and the synagogue and church. But as Dr. Kalender-Rich stated, we need to do that in a safe way. If you can do it outside, that's better. Obviously, it's getting warmer, so it's going to be more difficult for people to tolerate those temperatures. But spacing is of vital importance. The smaller groups, the better. Masking is vitally important, especially in indoor conditions as well. So if you can have the spacing, if you can have the masking, plenty of hand sanitizer as well doing that, you can reduce the risk as much as possible and make it safe for people to go back to those institutions and be in that community, but it's got to be in that safe manner.
And it sounds like these religious institutions are trying to work with the public, making
Absolutely.
online, like you said, spacing, outside services, online services, take advantage of it. Bob?
Ashley says, what happens if you've been quarantining at home for quite a while and are noticing some symptoms? How do you know when to seek hospital care versus just stay at home?
Yeah, that's good. You have to know your own body. You have to know your limits. Most people will have, and especially the younger you are, say under 50, especially under 65, you may have mild symptoms, you may have no symptoms. If you have mild symptoms, you have to continue to monitor yourself. You know what your body can tolerate. If your fever continues to be persistent, if you have continued or progressive shortness of breath where you can't breathe, those are some of the things that you have to take into account. And at that point, use your own judgment, your medical judgment, based on what you know you can tolerate. At least make a call into your primary or your medical team to let them know, and then continue to be in contact with them. And again, if the symptoms really get to be where you cannot tolerate, it's probably at that point time to go to the hospital.
Brandon has a question, and this could be for both doctors. If we are all masked, a group of folks, is it safer to visit with my family inside their home than meeting out in public? So if we're all masked up and the group is a reasonable size, can we still meet inside and have it be safe? Dr. Kalender-Rich?
It seems like outside in public is probably requiring a little more definition, right? So outside in public at a restaurant that is otherwise crowded with other people, I would say inside at home is going to be safer. Outside in public at a park where you're the only people there, I think outside really seems to have the best data on being the safest place to be.
Yeah, absolutely. You know, understand first of all the bubbles of the other people that you're meeting with in your family. There is a Chinese publication that does show that household transmission is actually reduced by mask wearing, and we would expect that as well. So, you know, advocate for that if you have to be inside. Certainly if you can meet outside and do it, it's better, just as Dr. Kalender-Rich said. The distance apart is important. Try not to share any communal utensils if you're, you know, delivering food to each other, things of that nature. But certainly outside is better. If you have to be inside, masking and proper hand hygiene is not an unreasonable thing to do. But if you can otherwise do it and keep spread apart in the physical distancing, those things are going to be most important.
While we're on the topic, it's 4th of July this weekend. Let's just get it out there, because a lot of people have different mixed messages and different rules for their family and having gatherings. I want to hear from both of you on what advice you have for people about having groups in, do you require neighbors to wear masks, you know, in the driveway? If they come inside, can they just use the restroom? How do you handle food? What advice do you have for people trying to be social but be safe?
This has been really hard, I have to say, really being separated from all of our friends and our family, and not being able to hang out in the ways that we always have done before. And particularly on holiday weekends, I think it feels like this is the time that we should get together. But when we get together, it needs to be with the right things in mind. And as Dr. Hawkinson already shared, that includes smaller groups, that includes masking, that includes physical distancing. You know, I think if somebody has to use your restroom and they wear a mask through your house and they, you know, your restroom is clean and you've used proper hand hygiene, I don't know that being in there for a short period of time is a problem. But hanging out inside certainly has different risks than being outside. It's going to be hot out, so we have to really watch that also.
Yeah, you know, we know from Memorial Day that people are going to be getting together. We would certainly advise smaller groups are better. Outside is the best. At that point, you can maintain 8 to 10 feet apart, and you can still have conversations and be with the ones that you want to be with, friends, family. Not sharing drinks, utensils for food, you know, communal food type things. Masks if you are inside. You know, we know that these things can happen. There was a report today on one of the news outlets of a young gentleman, 51 years old, who had gone to a barbecue. And then the day before he died said, I regretted going to that barbecue because he died of coronavirus. So these things happen to individuals. And anytime you get this disease, whether you are older, who are maybe higher risk to have something bad happen, or younger, you really are rolling the dice, because we still don't know all the dynamics of immunity and infection related with this disease yet.
Bob?
Holly is asking, if my elderly father is showing symptoms and was tested, should my mother also be tested? We don't know the results yet. Dr. Kalender-Rich?
That's an excellent question. I think that first of all, the results should come back soon. And waiting for those results can give you information. If that test comes back positive, then yes, definitely. The other person should be tested. And currently, in the meantime, it's probably best, and we'll see if Dr. Hawkinson agrees, to really separate those two, right? So just stay in separate rooms to really make sure that we're practicing all of these physical distancing protocols already while we wait for the test to come back. If the test comes back negative, we have a different dilemma, because sometimes the negative test is not always accurate, frankly. And so if the person who was tested continues to have symptoms, it may mean that we have to make different assumptions. And I think it's important at that time to really be guided by the primary care team and the medical team.
That's confusing.
Yeah.
So you're saying you could get a test, it could be negative, and then you have to get another test?
Yeah, well, no, absolutely. You know, sometimes we have talked about here about a false negative test. You know, I think you have to understand, where is the test being performed, exactly what test is it. You know, certainly here at the health system, we have very good internal validated data that our tests are very sensitive and very specific. So we know that our result 95 or 96% of the time is going to be the correct one. So I think it's important to know those dynamics about where are you getting tested, what is the test exactly. For the most part, these PCR tests are very sensitive, but I think the best thing to do, as Dr. Kalender-Rich said, is to wait for this result and then move on from there. And once the result is known, then discuss with your primary medical team or your primary provider on the best way to go. Until that time comes, certainly self-quarantine in the house, self-isolate in the house, good surface disinfection, good hand hygiene, and again, you can even consider mask use in the house at this point.
So if there's one person that's waiting on a pending test, the others in the house should be staying home, away from public places.
And that person should be self-isolated within the household.
Okay, thank you for clearing that up. Bob?
We've been hearing a lot of information about there's kids are very low risk to transmit child to child and child to adult. And with this information, do you think kids should be sitting in classes all day with masks on?
That's a good question. Do you want to take that to start?
No, but
We've
I'll
had
just tell
discussions
everyone,
about
I
this.
called Dr. Hawkinson this week to ask him this question about my own family.
Yeah.
Okay, so there, it's back to you.
You know, we look to our pediatric colleagues for help with this too. Again, the information talking about maybe reduce susceptibility and reduce spreading of the infection by children is somewhat indirect. It's a little bit of data, but it certainly is encouraging if that is true. That is another question of, do we think it's safe for children to go back to school? I think depending what school district you are in, now again, the virus is really moving through the United States, so most every community is going to be affected by the virus in one way or the other. Being in school is very important for children for various reasons. It's a safe place. It offers them lunch. Children need directed learning. It's very hard for most children to do self-learning at home. So schools are very important, but you have to understand what are the dynamics in that community, what are the rules and procedures put in place by that school district. Hopefully there will be mask use when the students can use it. Obviously the teachers are probably going to be need to use it. We have to keep our teachers and our support staff and our administrators healthy. So there are various details in there. But I think as we move forward, number one, we are going to be learning about more the prevalence of the disease and how it is spreading, especially in these next 2 or 3 or 4 weeks. Right now it continues to be spreading exponentially. And then what are going to be the parameters put in by that school district? And again, hopefully it's going to be mask wearing. It's going to be physically distancing as much as possible because we know that those two things are going to be very important for keeping people safe and really reducing the spread of the disease.
Ed, did you want to add something?
The only thing I would add is this idea of keeping the same groups of students and teachers together, with the idea that then if there is one group that perhaps is exposed, it's limited to one group.
I have another question, because I know lots of parents are wanting to get their kids back to school. Kiddos want to get back there as well. But we have a lot of multi-generational dynamics going on, whether you have a parent living with you or parents are childcare or picking up. How do you handle that aspect of it once kids get back into that school environment and now we're exposing our seniors?
So this is the question that I called Dr. Hawkinson with. I think we, first of all, have to look at each senior, at each older adult, and really look at their risk profile. That's a part of it, because if a person has just age as their only risk factor out of all of the long list that's on the coronavirus information, then they are at risk, but it's not the same risk level as someone who is an older adult who also has heart disease and also has multiple things on that list. That's number one. Number two, this is a balance. Everything is a balance. For many of us, our older adults in our lives are our caregivers for our loved ones when we're at work or when, for a variety of other reasons, or live in our homes. And for those people, we have to be particularly diligent. And that may mean that we see more people doing different types of learning that might include more online learning. As was already stated, our kids really need to get back to school. My kids really need to get back to school. And not just because I need them to go back to school. But
you can say it. It's okay. We're with you.
But we have to really be thoughtful about the risks and balances, and really also at the same time be so hopeful that the data coming out of some countries that are now starting their school year will help us know how this looks.
Bob?
Okay, here's another one on testing. We get a lot of testing
Yeah.
questions. Sonny says, our son tested positive on June 23rd, and his company will not let him return until he tests negative. Johnson County Health Department told him it's highly likely a retest will come back positive for 30 to 60 days due to particles still in the system. What can you recommend on when he should get retested? He wants to get back to work.
Yeah, that is a very good question. Unfortunately, there are people who can be testing positive. I saw one person who was perfectly well. He was an 80-year-old gentleman, was hospitalized in March. He was hospitalized for a week or two, felt really good, and has since felt fine. He hasn't had any of the recurrent symptoms or anything like that, but tested positive for like 13 weeks. So we do understand, and there are published reports now. We thought maybe 60 days, 80 days. There are published reports up to 95 days where you can test positive. Certainly here at the health system, we have tried to figure that out, and there are two different ways in which the CDC says you can actually discontinue COVID precautions, and that is either by a testing strategy or by a symptom-based strategy. The testing strategy would require 2 negative tests after some sort of time after they develop symptoms. But because we understand many people can test positive, again, 30, 60, 80, 95 days after having the infection, we've kind of gone away from that and really used the symptom-based. So we are in line with the CDC and the KDHE as far as time from symptoms or time from diagnosis, if everything else is good. If you're otherwise feeling good and your fever, you haven't been having a fever. I think really as we move forward, continuing to do the testing is very difficult because that will preclude a lot of people from going back and doing things. And so again, at the health system, at the hospital here, we have really landed on doing it a time from the date of the symptoms or the date of the diagnosis, and if you are otherwise fever-free and otherwise having improvement. We are not retesting just because of that fact that we know you can have persistent positive tests for a couple months at least, 2 or 3 months. So.
I'm going to combine a question from Aaron and Elizabeth. Some high schoolers are proceeding with band camp, close quarters, blowing on instruments, marching. Is that risky? And then Elizabeth was asking about cross-country practice. Kids are running next to each other, outdoors.
Yeah.
All sorts of factors going on there. What are your thoughts?
So I think camps or any area where people are congregating are going to be difficult and more risky for sure. The playing of the instruments, we don't have a lot of good information about that. I think there was one article that looked at how far can droplets get from a wind instrument, and I think it was like 18 centimeters. So I don't think we're as concerned about expelling or expressing droplets and virus through the instruments themselves. I would be more concerned about the people congregating together for a duration of time, especially if inside. That will be more difficult. Certainly sports we have talked about. We don't want to do specific sports and would rather make generalities, but specifically for cross country, obviously you're outside, that's better. You are running, there will be probably wind currents, it won't be still air. But a lot of times people in cross country either meets or practices run in groups. That's probably a little bit more dangerous. If you can continue to be separated while doing the running, that's probably going to be less risky as well.
I just have a quick question from Kathy, because we talk about high-touch surfaces a lot, and she was asking, what do you mean by that as far as, like, do you have to clean them with something special, or is it really just like a wipe it down and you're good? Or is it disinfectant?
So high-touch surfaces, we talk about horizontal surfaces such as countertops, tables, anything else that may be high-touch, doorknobs, railings, things of that nature. Again, we are lucky in the fact that this virus is very susceptible to really almost all of the common household cleaners. If you have a question about that, you can look on the back label. There should be an EPA number. You can look that up on the internet. But really, most all household cleaners, and especially soap and water, are going to be very good at cleaning those high-touch surfaces.
Okay. Good to know. Bob, what you got?
Yeah, Sean wants to know what constitutes a contact. How long does it need to be in order to transmit the virus?
Yeah, good. Any thoughts?
I only know what I generally tell people,
Okay.
which is time spent within 6 feet of one another, with or without a mask, frankly. And then we usually say 10 to 15 minutes, but I'm not sure.
Absolutely. Prolonged contact is usually, for the definition that's been very common, is 10 to 15 minutes. within 6 feet or less. Certainly, also in the healthcare setting, we talk about source control. So did the patient have a mask on, and did the healthcare worker have a mask and eye protection on? That's going to be important. But in general, for a prolonged contact, again, 10 to 15 minutes, I would certainly err on the side of caution with the lower amount. 10 minutes, 6 feet or less is really going to be the typical definition of contact, probably for most state health and county health departments, but also for the CDC.
Let's try to get in a few more questions. Gretchen wants to know, she was at a stoplight, pulled up next to somebody, they take a big puff on a cigarette, blow it out. We've seen it, it comes out, it either goes to your car or kind of comes back behind you. Do you think it could travel in smoke?
Yeah, we've had this question, and Dr. Stites has addressed this question. First of all, we don't want to advocate smoking. Hopefully that person will stop smoking, stop vaping. We don't really feel that that's a big risk with exhaled smoke or exhaled vaping. In general, the person probably just needs to stop smoking.
Good tip. Bob?
Okay. Janessa wants to know if you could give a recommendation to the Johnson County Board of Commissioners who are meeting this morning to decide whether or not to enforce the governor's mask mandate, what would you recommend? Bet I know the answer to that.
What would I recommend? I recommend that we definitely do need to enforce the mask mandate. I was talking with Lee Norman yesterday as well about this. There are very good data, publications. There's a new one from, and again, as we've been in this with COVID-19, there are a lot of journals out. There are a lot of people trying to produce articles, so we have to understand that some of those articles have been retracted. So we have to, what is the source? What is the article that we're looking at? There is one new one from a CDC publication, Morbidity and Mortality Weekly Report, which is very respected, that just was published 2 days ago, that one of their recommendations is definitely universal masking. So there is a lot of resources now, there are a lot of references and quality publications that promote universal masking, face masking. Again, the culture in Colorado where we were, very good culture of face masking and hand sanitizer. So we would definitely recommend it. The health system recommends it. It's going to be better for everybody. We know that universal masking decreases the spread of the virus, thereby decreasing illness, thereby decreasing critical illness and death.
Bob, last question.
Sure. Carla asks, what about the study using the polio vaccine to help for a 30-day period? How would that work? Is it safe, even for patients at high risk?
The polio vaccine itself, again, there have been a lot of talk and things about repurposing, especially drugs. We saw the hydroxychloroquine. None of these are direct-acting antivirals. There are other talks about using other drugs that decrease inflammation. This is now another concept of using a different vaccine. Again, we don't have a lot of data to suggest that. The polio vaccine could certainly offer some benefit as far as immune activation, but it is in no way the same as a vaccine such as the vaccine trials that are going on now, specifically for COVID-19 or SARS-CoV-2. I think using that in a trial method to see if that helps. I know that there was another vaccine that they looked at and thought it might reduce, and that was the Bcg vaccine, which we don't use in the United States. But the most amount of data that I saw, it really doesn't support the use that it really protects you from COVID-19 infection. So I think doing these things in a clinical trial and really looking at them and getting the good data is reasonable, but we shouldn't use that and put the eggs in all of our eggs in that basket, because again, it's not specifically for that. May it offer a little bit of benefit? It's possible, but at this point, we just don't have enough data.
Great questions today. So thanks for everyone. Pamela, Angela, Linda, Craig, Sarah, we've got your questions. We're going to hold on to them and we'll keep getting to those. So we appreciate everyone doing that. I do have just like one last question as we go into mandated masking tomorrow, and then hopefully it'll lead into both of your final thoughts for today. But a question we get too is just, we always say that when I mask, I protect you, you mask, you protect me. But it is hard when you walk into a place, which I've done just a couple of times this week, where I am the only person masking. And it's not like, I can't honestly say when I walk in, I'm thinking, oh great, I'm here to protect all of you when none of you care about me. So you start going, well, maybe I'm wearing my mask to protect me from all of you. is there protection for people? I mean, I know we say it can provide some, but
Yeah.
if that helps people mask, if that gets people to put on their masks, I mean, and that helps get everybody on board to say, hey, when you put on a mask, it might protect you from someone who's not wearing one.
Yeah.
Help me understand that a little bit.
Yeah, absolutely. You know, in the healthcare setting, we have really never advocated for cloth masks. We use surgical masks, which are vetted and come from companies that have done experiments to watch that. So those are for surgical masks and N95. In the community, cloth masks, and again, now I know there are typical surgical type masks that are being sold at grocery stores and pharmacies as well, and those are okay. You know, we know that it will not be as good as, say, a typical validated surgical mask, but even cloth masks and those other masks can block a little bit of the droplets, so it does offer a little bit of protection. What it's better for is, again, the barrier in case you are pre-symptomatic or asymptomatic and have been infected with the virus. So it's based on that. It's really about the barrier. You know, if you are coughing, if you are talking loudly or sneezing or anything like that, those masks can offer protection for you as well as being a barrier for someone who is ill. And, you know, certainly, hopefully, with the mask mandate, people will now be wearing masks. We obviously know that mask shaming has gone on, whether you're wearing it or not wearing it. We know, and history has shown, really, coercion doesn't work for various things, whether it be religion or other economic or social things. Certainly, if our leaders elect to make those mandates, that should hopefully work. And really what we're just trying to do from the pure medical standpoint is really stop the spread of the disease as much as possible. Because we need to continue to have our economy to grow. We can't go back to a shutdown. We can't have our essential workers, our delivery drivers, our people who are processing our food, making our food, who are stocking our shelves, the people at the stores that we're checking out at. We can't have those essential businesses go down. Our first responders. So we need everybody to be healthy. The masks, as well as the hand hygiene and the physical distancing, have shown to reduce the spread of the disease of COVID-19 and thereby, again, reduce all over morbidity, hospitalizations, and mortality.
Thanks for that reminder as we head into another big family fun weekend. Dr. Kalender-Rich, final thoughts today?
You know, my final thoughts are really balancing it. Balance is important in life, and we need to find ways that we can strike the balance that allows us to do all of the things that are important to us, at least most of them right now, and to be able to do more things later because we have flattened the curve and helped extinguish this.
Thank you so much for being with us. And another congratulations on your appointment to the committee. We appreciate that. All right, you're rid of me next week because Dr. Stites is back.
Yes.
You're done with me. Dr. Stites will be back from Colorado.
Yeah.
And Homeland Security is issuing increased warnings around COVID-19 and the sharing of misinformation. So Sean Roberts, he is the Vice President of IT Technology. He will join us to offer advice on avoiding financial security risks. And Dr. Stites and Dr. Hawkinson, of course, will talk about the physical risks. So we know that masks work. We talk about this. This is the message. And as of tomorrow, they are required in most areas. And here are some of you who have been doing it way before you were even told to be doing it. This is Kelsey. She works. She's one of our trainers out at the Sports Performance Center. So she's assisting one of our clients getting back to work, helping our folks out in the community, but doing it in a safe way. Here's Ashley. Yep, getting her hair done. That's essential, I know, for some people, but her and her stylist are staying safe inside the salon. And this one's from Charity. She says that her kids were trying to figure out how to smile with their eyes, but little buddy needs to pull it up over his nose. But you guys are doing a good job. That's a good start. So we're proud of all three of you. And then Carrie sent in her kiddos, Henry and Nora. They're heading out to their first baseball game. Henry even wears his in the dugout. So way to go, Henry. We appreciate you being a leader. And this is Reginald Dusing. You know him,
Yeah,
Dr.
hi.
Hawkinson. So he
Hi,
sent
Reg.
this in. He says, you've been given so much
Good.
great information. He really appreciates it. He used to be a doctor here. And he says, having practiced as a family practitioner for over a decade, I found that appealing to people's better nature is the best motivator. He says, people will often do for others what they won't do for themselves. In fact, he says, I wear a mask that says, as you see it, wear a mask, save a life. It's printed right there on it, which he says he loves to wear to Sam's Club and Lowe's so that the defiant can get the message. I think he's pretty clear there. So Dr. Dusing says, I really think wear a mask, save a life should be the national COVID-19 mantra. I think that's a pretty good idea. So please send us your photos of you staying safe out there, doing it right, wearing your mask, social distancing, and send those to our Facebook account or email us at medicalnewsnetwork@kumc.edu. As we've been telling you, we also want to share your stories about folks who have either lost the battle with COVID or who have beat COVID. We want to start putting a face and a name with these numbers and help the community better understand the seriousness of this disease and that it's the real deal and it's not going anywhere. So reach out to us on Facebook or Medical News Network at kumc.edu. We want to hear your stories. And we want to hear from this guy, Dr. Stites. He's back. He's back Monday, and he is going to leave us with the final words today from some gorgeous location in Colorado. So thank you all so much for being with us today. Have a very safe 4th of July, and we'll see you Monday.
Good morning. Steve Stites here from Colorado. I'm up on the Grizzly Creek Trail, and that roar you hear in the background, well, that's Grizzly Creek. My wife and I are hiking up and doing a little fishing this morning. Wanted to let you know how beautiful it is, but also making sure that you're staying safe. You know, the numbers are rising in Kansas, they're rising here in Colorado, and they're rising across the United States. What are we going to do? You know, we've done it before, right? We've already bent the curve. We can bend the curve again. And how do you do that? You follow the basic principles of infection control you hear us talk about every morning. Wash your hands. Don't touch your face. Wear a mask when you go out in public. Make sure you cough into your elbow. Don't go out if you're sick. All those things we say every day, they apply to you no matter where you go and no matter where you travel. We had a beautiful trip. I believe we stayed safe. We've worn our masks. We've washed our hands. And here we are in the wilderness. Right now, there's no one else around. Maybe a few bears or something. But most of all, we wanted to let you know that you can stay safe wherever you go. And you can do it even as the numbers rise. We can change that curve because we did it before. In Kansas City, we can do it again. So BKC, stay safe. And remember, no matter where you go, even if it's here in beautiful Colorado, there's still no place like home.